Welcome to Weight Loss Surgery Q&A, question and answer. I hear all the time, is this normal? What should I expect? Surgery is just one tool. It's time to put the other tools in the toolbox because it's your body, your health, your life. Just a reminder, I'm not a bariatric surgeon. I'm not a doctor. I'm not a medical professional. I'm not a nutritionist or a dietitian. I'm not a therapist. These are my own experiences. These are questions that have been asked of me. These are some of the experience I've went through. I have done mounds and mounds of research. I've worked with a lot of bariatric surgeons, and this is just my information to share with you. I always advocate that you need to do your own research. Do not take my word for gold. You need to do your own research and your own preparation. And it's to be used for informational and educational purposes only. If you stick around to the end of this video, I'm going to let you know how I lost 130 pounds. I was sleeved in early 2019 and how I maintained that loss actually through a pandemic. What was my secret to my success? So there's a lot of questions here, so I'm going to try to get through them. There might even have to be a part two. These are questions that I hear often, that I even had myself before I had surgery, and with people that I am talking with. These are just some typical questions about weight loss surgery. Hopefully they can help you. I will have links to videos that I've already done on some of these topics down in the description box, but also they're great ideas for future videos, so please stay tuned. First one is, I'm starting to question, do I really need this surgery? This is a normal question, and nerves and anxiety are just super normal as well, because you should be questioning any surgery that you have. Will this benefit me? What are the possible complications and risks? But what I do ask you is take an unbiased look at your life. Make sure you're thinking about yourself first. For many, weight loss surgery does save lives and can resolve obesity health-related issues. You are not being selfish when you make the decision to put yourself first, make yourself a priority, and want to save your life. So when you're asking yourself, do I really need this surgery? You need to ask yourself, have I done my research? Am I prepared? Am I committed to changing my life no matter what? And remember, it is your decision. It should only be your decision. Of course, you're going to have other people in your life that your decision impacts, but at the end of the day, it's your body, it's your health, and it's your life, and it's your decision. Why do I need to do a liquid diet or a low-carb diet before surgery? Number one, it's to shrink your liver. Shrinking the liver just allows the surgeon to easily access the surgical space. So it's a way to get to your stomach, to see your intestine, see your digestive tract. So shrinking that liver, because if it's a fatty liver or if it's enlarged, it makes the operation a little bit more difficult. It probably increases the time that you need to be under the knife or under the anesthesia, which then sometimes increases the risks of the surgery. It also reduces poor wound healing. Your wounds, your incisions will need oxygen and a healthy supply of blood to help it heal after surgery. Having excess fat just taxes the body. It puts tension on your blood and oxygen systems, which then increases your time to heal. Excess fatty tissue can increase the time you are on that operating table, which has a potential for increased infection. And if you develop an infection, it just means you have to take antibiotics or other medications, or possibly have another surgery, meaning you have to spend more time in the hospital. Shrinking that liver also helps to reduce the risks or the complications of anesthesia. Excess fatty tissue just gets in the way of doctors administering or delivering the anesthesia to the body. Obesity can also make it very challenging for the correct dosage of anesthesia. So the lower weight we can be when we go into any surgery, the better off we'll be. Our pre-op diet can also help with decreasing cardiovascular issues or problems. If we're obese, our heart just works harder. Why should I quit smoking before surgery? the end of the day, smoking decreases blood flow, making surgical wounds less likely to close, less likely to heal well, and more likely to become infected. Smoking also weakens the immune system, which also increases infection possibility after surgery. Why are the first couple of weeks after surgery so important? The first couple of weeks after weight loss surgery is called the make it or break it period. It's the most crucial time for many of us for the overall outcome of our surgery's success, but also the riskiest time for complications. A majority of all complications, if they do happen, typically occurs during the first 30 days post-surgery. What are some challenges I will face after bariatric surgery? Getting fluids in. For a lot of us, gas pain. Many of us, constipation and or diarrhea. Nausea and sometimes vomiting. Dumping syndrome. Lower energy or just plain darn fatigue. Possible gain of weight, I hate to say it. Emotional hunger and cravings. Changes in tastes. Like some things might taste sweeter, some things might taste saltier. Sometimes it's a change in temperatures. For example, water intake. Sometimes before surgery, we didn't like it super cold and now we need it super cold. Or maybe we have to try it at room temperature or a little bit warmer. Food tolerances and or food reactions. I've heard of, and I even know for me, that there was things that I could not eat before surgery, and now I can eat them. Feeling cold, acid reflux or heartburn, and just feeling irritability. Feeling like you just don't want to talk to anyone, or you find yourself kind of maybe venting more than you usually do, or you find yourself a little bit with a short temper. Now, we all might experience those side effects. Some of them, all of them, a few of them at different levels at different times. Definitely our first couple of weeks, we're going through the healing stage. If you ever feel like you have to talk to your doctor, always do so if you think it's a concern. But generally, for most of us, it is just kind of our body adapting, settling, and healing. And we experience some of these side effects. What are some possible complications after being sleeved? Typically, not in every single situation, but typically the gastric sleeve surgery is a little bit easier to manage than, say, some of the more invasive procedures like the gastric bypass. Even though there is a low possibility for a major complication, there is still a possibility. One of the most dangerous complications that someone that's being sleeved experiences is that the esophagus stretching or dilation. These can occur because of excessive vomiting, binge eating, or stomach obstruction. A stomach obstruction is typically when food is stuck or some kind of internal swelling, which can happen from bleeding, organ injury, or even infection, leakage, blood clots, a delay in the food moving down the digestive tract, esophageal pain, or spasm. As I mentioned, major complications are typically very low statistically. You do have to recognize that there is a possibility. There is with any surgery. And my suggestion is to kind of have that conversation with your doctor. I know for me personally, I signed the paper and I kind of in my head said, yeah. But my doctor really didn't explain all those. And I'm not saying to dwell in the horror stories of what people go through. And, my heart goes out to them because it does happen, but it is statistically low. You do need to know that there is a potential for it. And my suggestion is to have a plan for that. Do I need to stop smoking after surgery? It is important to remain non-smoking after surgery. It allows your body time to recover and heal. Smoking makes recovery harder because it puts excessive stress on your heart, affecting your blood pressure, reducing oxygen in your blood, and damaging your lungs. All things that you need to heal and recover. What are stomach staples? The staples in our stomach when we are sleeved are titanium, which allows for an MRI and to bypass airport security. I don't mean bypass as in you get to go in free, meaning the full body scanners will not detect the stomach staples. They're not removed. The staples will remain in our stomach. The stomach will heal just like other areas of the body and will form a solid stomach barrier. How much pain should I be in after surgery? For many of us, the first 24 hours is probably the worst. For some of us, it can last a week, and some of us, it can last 2 weeks. It all depends on our own situation, our own bodies, our health history, and what's going on, our pain tolerance. But the first 24 hours, most of us will feel gas pains in our stomach, maybe our chest, and in our shoulder. The pain in our incision areas can be very uncomfortable for some of us. But remember, although the pain is there, the better we can get up and walk and dissipate some of that gas pain, the better we will be off. Walking, moving also helps to decrease the chances of having or developing blood clots. You may also feel like stinging around your incisions. And your muscles around your incisions will feel super sore for some of us. Your tummy might be bruised, but if there's excessive amount of bruising, you need to call your surgeon immediately. What type of pain should I expect is normal? The simple answer is pain is an individual thing. Pain tolerance is very individual. Should I expect any oozing or bleeding from my incisions? It's okay to have some bleeding and oozing from the incision sites, although typically, generally, after a week, you shouldn't see any more of that oozing or bleeding from those sites. When you get to day 8 and you are still experiencing some of that oozing or bleeding, contact your surgeon. What if I suffer from nausea or vomiting when I arrive home? Depending on the amount, the level is what you should be concerned. A little bit of nausea, a little bit of vomiting is kind of something that we experience. But if it means it's being excessive, your body is just not being able to settle down, then you need to contact your doctor for either to see if there is a situation that needs to be dealt with or get a prescription for anti-nausea medication. When should I remove the bandages around my incision sites to bathe? Now, every doctor, every procedure is a little different. Make sure you ask your doctor this. When is the first time I can shower or submerge myself in, say, a bathtub? When can I get those incision sites fully covered with water? Now, you might have to change them if you do have some bleeding, but only if you have bleeding and oozing that gets to the point where you need to change your bandages. Typically, you want to not remove your bandages, let them fall off, but you want to know when you can submerge yourself fully in water. How much swelling or bruising should be expected after surgery? Some of us, there is usually a moderate amount of swelling or a moderate amount of bruising near or close to the incision sites. This really should subside after a week or two. But like I said, if you do feel that it's excessive or it's a long time and it's not going away, you need to contact your surgeon. You can try applying a warm compress every 20 minutes or so, a couple times a day, to maybe relieve some of that swelling. So when do I go to the ER, the emergency room? If you have a fever, excessive pain, stabbing pain for sure, and if you have red and hot incisions. If you believe you may have an infection, contact your surgeon, go to your local doctor if you can, or visit an ER if that's an option. These kinds of situations will need treatment, typically with antibiotics immediately. When you do visit, if it isn't your surgeon and you do visit an ER or another doctor, make sure you let them know who your bariatric surgeon is and what center they're from, and let them know you've had bariatric surgery, what type of surgery, and when did you have it? They might want to look into this further and contact your surgeon to make sure they're on the same page and how to treat you moving forward. When can I return to work? This really will depend on your physical requirements of the job that you do. This is a really good question to check with your doctor, your surgeon beforehand. When can I return to work? This is what I do in my work. This is the physical requirements that is expected of me. Typically, the bariatric surgeons will tell us do not lift more than 10 to 15 pounds 4 weeks after having surgery. As we talked about after bariatric surgery, there can be side effects like nausea, vomiting, fatigue, or even mood swings. So this is something that will be individual for you. Are those side effects so beyond what you can handle at work? So these are things you need to ask yourself and evaluate. I would strongly suggest you don't make a plan to immediately go back to work. You need time to heal, allow your body to settle, and for you to kind of, I hate to say it, experience some of those side effects and see how that impacts your day and how to make decisions moving forward. Typically for gastric sleeve patients, you want to look at 5 to 10 days after having surgery. More invasive procedures like the bypass or the duodenal switch might require a longer time away from returning to work. Why should I be concerned about stomach ulcers and/or my gallbladder after surgery? Studies have shown that approximately 25 to 30% of bariatric patients may develop symptomatic gallstones within the first year postoperatively. Now, gallbladder problems in many obese patients already seems to be an issue. It might not be symptomatic before you have a surgery, and then all of a sudden the rapid weight loss kind of triggers it and it becomes a problem. Now for me, I had my gallbladder actually removed 3 months prior to being sleeved by the same surgeon. Sometimes surgeons will take out your gallbladder at the same time as being sleeved, and sometimes for many of us, a gallbladder issue kind of develops within the first year and sometimes years postoperatively. In my situation, it wasn't actually gallstones. It was the functioning of my gallbladder. It couldn't function. It was only functioning at 1%. It wouldn't allow the bile to be pushed out of the gallbladder. Majority of the issues is developing of gallstones. Gallstones are primarily developed because of high cholesterol levels and high fatty deposit levels. I'm a big believer in understanding the function of the gallbladder, the liver, and the pancreas. It's like a trio that works together in regards to bile production. Now, if you do feel like you have a gallbladder issue, if that comes after, talk to your bariatric surgeon, if it's before, during, or after. And sometimes, just to let you know, in my situation, it wasn't detected by an ultrasound. I needed an actual HIDA scan to detect that there is an issue with my gallbladder. So if you do feel that is an issue and you try the ultrasound, you may have to ask for further investigation to see if it is a gallbladder issue. What is happening really quickly is the liver creates bile, which is like a detergent for fat. It helps the digestion of fatty acids. Bile is unable to process as it should, which causes a blockage sometimes of a duct, or it can create gallbladder problems such as gallstones. Our bariatric surgeries it alters our gut. It alters our digestive tract and how it works. And our gut, wherever that is on that digestive tract, all of it works together to help the body absorb nutrients and calories from the foods and drinks we ingest. We need the bile to help in that process. I did my research in regards to the gallbladder and the connection between the liver and pancreas and how that all works and how it's super important to understand how that works, especially if our gallbladder gets removed on top of the situation of our compromised digestive systems. So I will be doing video in the future regarding that, because I think it's important as bariatric patients to understand that trio and how it's all connected. And yes, you can live without a gallbladder, but there is consequences to that. And I will have some suggestions on how to reduce some of those consequences and make the quality of life a little bit better. So stay tuned for that video. Why am I losing weight so slow after gastric sleeve surgery? It is common the first couple weeks to not see any loss at all, or even possibly, oh my God, I'm going to say it, some gain. This is a time where your body is healing, adjusting, it's finding its way. And a lot of times we might see a gain, which means it's not a gain of weight. It means it's kind of our body holding onto fluid, water, because when you have an infection or an injury or surgery, a little bit of trauma to our body, it's our body really doing what it's needed to do. It's holding on to weight to help the body kind of work towards healing. So sometimes we can gain weight, which is water weight, when we immediately come home from surgery. It's super important to have realistic expectations after returning home. We want to have a safe, slow losing of weight. With that being said, weight loss for us, each one of us are individual, and we will lose weight at different rates. For me, the most of my weight was after 6 months. I was a very slow loser, thinking, oh my gosh, this isn't working for me. But really, I just kept at it, understood, had realistic expectations. And then after the 6-month mark, it really just started to drop off. Remember, bariatric surgery is not like getting liposuction. The fat just doesn't instantly drop off. We have to do what we need to do. We need to be patient with ourselves and allow our body to do what it needs to do to lose the weight. Here are some reasons to consider if maybe you are super slow or not losing the weight. Not eating enough calories. Follow your surgeon's plan, but sometimes we just don't want to eat. We don't have the desire to eat, so we don't eat. And so many of us still buy into the myth that the less we eat, the more we'll lose. That's actually called starvation mode, and your body is going to lock itself down. It does not like to starve, and it's going to hold on to the weight. When your body is nourished properly, your body will start burning fat. But if you're starving yourself and you're not getting enough calories, you're actually going to start losing muscle. The more muscle you lose kind of correlates with the more plateaus and stalls you might experience. When your body starts to think it's in starvation mode, it's going to work against you, make it even harder to lose weight. It will hold on to every ounce, which will increase the number in some of our situations or keep us in a stall longer than it needs to. So many people after surgery, when we get to graduate to more solid foods, we either have developed kind of a thing like we don't want to do that. Oh my God, I'm going to gain weight. Or we just have a hard time transitioning to that whole food-based solids. I often hear people say, oh, I can't eat chicken, or I can't eat beef, or I just can't eat solid protein foods. And that might be very, very true. When we first start out, it's a lot of trial and error, what works for your body and not. And I can't tell you what that is. Sometimes for me, chicken, I have a hard time eating chicken. Sometimes it's fish. Sometimes it's beef. Proteins can be very picky in regards to our body. And sometimes it happens for a while and it changes. So it's a trial and error thing. But sometimes when we move to that solid protein food-based phase, it's hard for us. It might make us nauseous. It might kick in our restriction like full on. We can't get our food in. So we kind of back off from it and we kind of find those slider foods that maybe work easier. They go down easier. We don't feel sick. And we just rely on those foods to get us through the day. These type of foods generally lack balance and substance, which can cause you to feel hungrier faster And many times they are simply processed carbohydrates. Yep, I'm going to tell you here and now that those carbs, a lot of them are slider foods. It's amazing how we can't eat our protein, but man, those carbs, especially the high processed ones, the sugary ones, the sweeter ones, those seem to go down with no problem, but they're not good for us. When can I resume normal sexual activity? I've asked a few bariatric surgeons on this. The general rule of thumb, once again, ask your surgeon. I know it can be a little embarrassing, but if you're concerned at all, your doctor is going to have the information. But generally, you can have intercourse 1 week after you return home. Now, you have to look at your own situation. Are you in pain? What are you feeling? How is your body healing? Is it healing properly? What side effects are you experiencing? That's all going to determine when you should have strenuous activity. And then your sexual habits, how strenuous is that? How passive is that? That's all going to play into when you should start resuming normal sexual activity. The big one is, when should I weigh myself? For many of us, weighing ourselves multiple times a day, every day, and then we don't see any change, and we're telling ourselves, I'm not losing weight, is just a plan for disaster. Definitely after surgery, give yourself a few weeks to allow yourself to heal and adjust. Patience is a crucial part of success, and definitely the first couple of weeks after surgery. Inches lost, better lab work, pictures, and just generally how you feel are always going to be better indicators of progress and success. It's super important to remember that each one of us has unique bodies. Everybody's body is different, and our situation is going to be different depending on our health history, what procedure we had, how our body reacts to the surgery, and just our plan in general. So it's super important to remember, have realistic expectations. Don't compare yourself to someone else's journey. And a lot of times I find people, myself included at first, I was comparing my beginning to someone's middle, or maybe my middle to someone's end. Stop the comparison. Try to weigh yourself on a regular, consistent basis. But as a lot of you are going to find out, if you weigh yourself multiple times a day, your weight can actually fluctuate even multiple times during the day. So find a consistent day, a consistent time, and just see the progress in that kind of lens with that perspective. Why can't I drink carbonated drinks? Generally, carbonated beverages should be avoided for at least the first 3 months. Now, some of our surgeons are telling us forever. There is kind of two schools of thought on that. If you do your own research, you're going to find where that is a myth, or you're going to find that that is a must. Definitely at the beginning after surgery, the bubbly drinks can cause gas, upset stomach, nausea, and those are things we just don't want to have. And our stomach is really healing at this time, so we don't want to add stress to that. However, every patient is different. After the 3-month mark, you need to have a conversation with your doctor. My surgeon allowed me to have it. I have carbonated seltzer water, and I probably had it ever since 3 months, and I don't have a problem. I don't drink it excessively, but I don't have a problem with it. Now, that might be different for you. Your body might react to it differently, or your surgeon says absolutely not. That's a conversation you need to have. Now, sugared sodas, it's just empty calories and can lead to dumping syndrome for sure. So that is, I'm a big believer. You make your own decisions. You're an adult. You have your own life to live. I personally would stay away from sugared sodas. I don't think I want to have something that I can't control or might make me sick. But that's up to you. But carbonated drinks, especially at the beginning for the first 3 months, after that, you need to have a conversation with your doctor. What medications should not be taken post-op? The whole thing about this situation is a lot of people are like, oh, but I take Tylenol, I take ibuprofen, I used to do this and I never had a problem. The thing is to remember that after surgery, bariatric surgery, our digestive tracts have changed. They've been compromised. And we're trying to get them to heal and work properly and not develop ulcers or other conditions. So anti-inflammatories, pain medications, and just any of your other medications that you had before having surgery, you need to have that conversation with your doctor. I would assume you have, but it's important to understand that it's not because they're just saying it, it's because there's a reason. And our digestive systems have been compromised, and we don't want to add further problems onto it. A big question I get is, what about taking vitamins? It's highly recommended, and we've been told that we need to take a multivitamin manufactured with high quality ingredients for the rest of our lives. Now, there might be other vitamins that your doctor recommends. I take more vitamins than actually a multivitamin, but the important thing is source. Where is it coming from? How is it made? What are the ingredients? What are the dosages in the ingredients? Don't just think that one multivitamin is equal to another multivitamin in a different brand. Some of them are different dosages. Some of them have fillers and preservatives that maybe we don't want included. You have to look at the source. You have to look at the quality of ingredients. Now, some surgeons have issues with the following. Some do not. My surgeon did not. There's other ways to take vitamins. Of course, there's vitamins come in different forms. There's chewable, there's soft chew, there's hard capsules, hard pills. There's drinkable versions like liquid vitamins. There's ones that you put underneath your tongue, sublingual, that allows it to melt and directly absorbed underneath your tongue. There's injections and there's patch vitamins. I'm not saying that patch vitamins works for everyone. I know it did for me, and how I know is I've been doing it for the last 2 years, but I take blood work every 3 months. My doctor and I look at the blood work to make sure that the patch vitamins are working, and for me, they are. Now, they might not work for everyone. So this is a conversation you need to have with your doctor, but there are other forms of vitamins out there, the way to get them into your body. Many of us wonder, can we have alcohol after gastric sleeve surgery? The answer has a lot of variables. It's not a black and white yes or no. Many surgeons will recommend that patients do not drink alcohol after having surgery. That might not be realistic for some of us. No judgment, no shame, no guilt here. This is your decision, a conversation you need to have with your doctor. However, if you do decide to have a drink, you need to understand that your stomach is smaller. It's a fraction of the size it used to be, which for some of us, be very cautious, because a little bit of alcohol impacts us differently than it did before surgery. The littlest amount, this isn't for everyone, but the littlest amount can make you impaired faster. Also, be very aware of transfer addictions. Transfer addictions really quickly is we've taken our food addiction and now we have transferred it to something else. And alcohol statistically has been one of the bigger ones that people will generally go from food addiction to now alcohol transfer addiction. Also remember, once again, no judgment, no guilt, but the reality is alcohol has no nutritional value. And our liver considers it a poison. So what do I mean by that? It means it will stop everything else, its functions, to get rid of that poison. So absorbing nutrients, bile production, the whole thing is put at a little bit of a halt. It's put on the back burner until it deals with the alcohol. Can I or when can I drink coffee? To have bariatric surgery, we make a lot of sacrifices before surgery and after surgery. Our pre-op diet can be pretty strict for some of us, and caffeine was one of those they told us to get rid of. Most of us succumb to that. We know we have to do that. We make the sacrifice in doing so. But the thought of not having caffeine after is just terrifying. We're usually left on wondering why. Why can't we have caffeine after surgery? Coffee has a lot of interesting properties, and some of them are the reasons why we love it so. Caffeine is a natural diuretic, which means it causes you to lose water through urination. One of the biggest issues bariatric patients have after surgery is water intake, fluid intake. So drinking caffeine can actually make that issue even worse. Dehydration is a serious risk for bariatric patients. That is one of the main reasons that surgeons will ask us to refrain from coffee, especially at the very beginning after surgery, so that we can ensure that we're making water intake, fluid intake a priority. Another problem is that caffeine, and a lot of us know this even before surgery, that it is a hunger suppressant. Many of us don't see this as a big deal, right? We're trying to lose weight. We don't want to be hungry. But actually, hunger is a big problem for many of us after surgery. After surgery, our main focus is to have a proper protein intake, which helps us heal and build muscle. If we add caffeine on top of that situation, and it even suppresses our hunger even more, we can be at a really serious situation. And lastly, one of the caffeine issues that can happen is it increases gut motility, which for a lot of us know that it can help us with going number 2 in the bathroom, which for some of us in our situations is just, it makes it too easy to go to the bathroom, which allows for food not to be completely absorbed and maybe pushed through too fast. A lot of us, our surgeon will allow us to drink 100% decaf coffee after surgery, but for some of us, that's not good enough. I personally had to wait 3 weeks. Now that's going to change with every doctor. My doctor was okay with my situation and how I was proceeding after surgery and allowed me to introduce coffee after 3 weeks. But even with that, I kept in mind that hydration was my number 1 priority. Meeting my protein goals so that I could heal was just as important. So I limit my caffeine. I still to this day limit my caffeine to 1 really good cup a day. I do not have it after that because I'm still learning. Even 3 years past post-op, I'm still learning about my body, and I don't want to impact it in a negatively way if I don't have to. Is it normal to experience a plateau and stall this soon? Now, everyone's different, but typically right around the 3-week mark, we experience our first plateau. A bariatric plateau or stall is normal, temporary, and generally caused by the body's just attempt to adjust to a new diet and new lifestyle changes. It's trying to navigate its way from being a sugar burner, meaning high carbs, high processed, to now being a fat burner where we use ketones. It's important to notice the difference between an actual stall and your body still progressing. What do I mean by that? Sometimes we're not in an actual stall. We're still losing inches. We look smaller. Our clothes are fitting looser, and we just feel generally better. That is more of an indication of progress than any number on a scale. Do I have body dysmorphia or am I just insecure? Body dysmorphia is an actual documented disorder and is more than just feeling insecure about your appearance. Most of us before surgery, after surgery, we still have insecurities about certain our appearance and the way we look. And we really wish we could change that, or we are wanting to change that so desperately. It is really normal to have days or incidents where we look in the mirror and we just don't see change, or our mind has not caught up with our body yet, and we feel like we haven't lost weight, but others are telling us, yes, you did, or we look at a different picture and we realize side by side, oh yes, I did lose weight. That is more about having a distorted body image. That's body image issues. And being in the weight loss community before even surgery, we kind of get that, right? Having a distorted body image. Body dysmorphia disorder, BDD, is a situation where you really need to be reaching out to a therapist and helping you work through that. It's a great accomplishment to lose all this weight, significant amount of weight, but we're not used to hearing compliments or getting the attention that we did before surgery. For many of us, we were invisible before surgery. And now, after surgery, we're losing significant amount of weight. we're getting attention. And now our weight, our look, our body image is now everybody else's business. This kind of transition can be uncomfortable and unsettling for a lot of us. When we get to the point where I am saying to myself, I wish I was big again, and I'm starting to self-sabotage my success because I can't deal with what I'm seeing, that is a good indication to reach out to someone who professionally can help you. No one magically taught us how to deal with a positive body image. It's work, it's a skill, it's a strategy that we need to continue to work on and get the resources that we need, do the work, get the books, talk to the people we need to work on. Surgery was just one tool. This is another tool we need to work on to have long-term success and have a healthy mindset about our weight loss. Will I ever enjoy my favorite foods again? Yes, you're going to make sacrifices before, during, and after surgery. And yes, I'm here to tell you that you can live a full life, and that can include your favorite foods if you choose to do so. Just at the beginning, you are healing, you are adjusting, your body is trying to find its way. Now, with that being said, you'll just have to decide which foods gets you closer to your goals and which foods do not. Some of us are going to be forced to deal with certain foods because of after surgery, our body doesn't tolerate them the same. Typically for many of us, after the first month of healing, we can almost eat anything we want. But the key thing is the whole reason many of us are doing this is to establish a new, healthier way of looking at food, eating food, and how we incorporate food into our lives. The first 12 months is what they call the golden year, because for most of us, that is when the weight tends to release. And fortunately, I know for me, at first this was a major concern of mine, but fortunately for me, my food taste changed. I just don't crave the unhealthy foods like I did before. Now, when I get into that trap of too many slider foods, grazing all day, starting to incorporate some of those highly processed sugary foods, I feel sick. I can eat them. I might suffer a little bit of consequences, but I realized my body just doesn't like that anymore. And when I kind of choose to stay away from those unhealthy things that got me to my surgery date to begin with, I just feel better. And I want to feel better. If you're familiar with my videos, you've heard me say surgery is not a magic pill. It's not a silver bullet. It's not quick fix thinking. Remember, a lot of those people out there tell us, oh, you took the easy way out. No, it's not the easy way out. So stop thinking like it is the easy way out. It demands that we commit to having lifestyle changes, to meet our health goals, to have long-term success. I try to look at food now as the fuel that nourishes my body so that I can live my best life being my best self. And I can tell you that I actually got excited because I was a foodie. I like to cook before surgery, and I was a little bit scared about that. But what now that I've done, and I think my husband appreciates it, is that I've just become more creative. I've really figured out ways to take my comfort foods and make them healthy and work for my body. I think you can do it too. And lastly, what is my secret success, my secret to maintaining 130 pounds, weight loss, even through a pandemic? Well, it's a few factors. First of all is I realized really early on that surgery is just one tool, one tool in the toolbox, and we need all those other tools in the toolbox to have a sustained and maintained weight loss long term. So that was the first thing. I make sure I keep learning and researching. One of the reasons I started this YouTube channel was I knew I needed those other strategies and skills. So I did my due diligence, worked hard, got extra training, and I've applied them to my life. and I want to help others that maybe they just didn't get the information they needed to do to keep moving forward. The other thing I do is I eat pretty clean. I'm 90% of the time I eat pretty clean. I eat ketogenic. I will do a video on that a little bit later. I actually got trained in bariatric ketogenic living. I really are super focused on quality of ingredients. I stay away from highly processed foods. I'm pretty low carb, and I know what the difference is between good fats and bad fats. The other thing that I do is I always refer to my bigger why. I have a bigger why, and that's, like I said, to have my mind connect with my body, to live my best life, living my best self. I am done with the roller coaster of weight loss. I'm done with it. I did all the things before surgery. Surgery for me was the biggest decision, the biggest sacrifice I ever did, and I'm not going backwards. So for me, I look at everything, every choice that I do, and don't get me wrong, I slip up. I'm human. But when I need to get back on track, when I need to pick myself up, I make sure I refer to my bigger why. It's all about health. I want to grow old being healthy. I don't want to have all the other health conditions. I don't want to suffer. I deserve to live the best life. And so that's my choice. And that's generally what is my secret to success. So hopefully you got some value out of this. Please give it a thumbs up. Please put down in the chat box, the comment box below, what are some topics that you would like videos on? What are some questions that you still have? I just want you to also heal properly, live your best life, and really sustain this long term. We all deserve that. So see you in the next video.